Chapter 1: Vital Signs and Assessment. The stethoscope, the ultimate symbol of healthcare, an acoustic medical device. It features a sensitive chest piece that amplifies the subtle internal sounds of a patient's heartbeat, lungs, and intestines. The sphygmomanometer, better known as the blood pressure cuff. By inflating a rubber bladder around the arm, nurses can momentarily stop blood flow to accurately measure the intense pressure inside the arteries. The pulse oximeter, a non-invasive digital lifesaver. Gently clipped onto a patient's fingertip, it shines special light through the skin to instantly calculate the exact percentage of oxygen currently traveling in their blood. Medical thermometer, the heat detector. Whether it is a digital oral probe or an infrared forehead scanner, this vital tool instantly detects danger spikes in core body temperature, signaling a potential infection. The pen light, a simple but crucial diagnostic tool. Nurses use this intensely bright, highly focused beam of light to check if a patient's pupils are properly reacting, which directly tests for severe neurological damage. The syringe, a precision fluid delivery pump. Consisting of a tightly sealed plunger inside a cylindrical barrel, it is used to draw up exact life-saving doses of liquid medication. Hypodermic needle, the delivery mechanism. An incredibly thin, hollow tube of surgical stainless steel. Its tip is precisely beveled to a microscopic point, allowing it to effortlessly slice through skin with minimal pain. IV cannula, the gateway to the bloodstream. A tiny, flexible plastic tube. Once a nurse uses a needle to place it safely inside a vein, the sharp needle is removed, leaving the soft plastic behind for continuous medication. Saline bag, the hydration station. A sterile, sealed plastic reservoir filled with a precise mixture of salt and water, directly connected to the IV line to rapidly rehydrate patients or deliver continuous antibiotics. The tourniquet, the vein finder. A highly elastic, heavy-duty rubber band tightly tied around the patient's arm. It temporarily restricts blood from returning to the heart, causing the veins to bulge outwards for an easy needle stick. Chapter 2: Wound Care and Sterile Procedures. Sterile gloves, the standard for invasive care. Wrapped individually in a paper packet, these latex or nitrile gloves are meticulously packaged to ensure zero contaminants touch the nurse's hands or the patient's wound. Gauze sponge, the basic absorbent pad. Made of loosely woven cotton fiber, these soft, square pads are the go-to choice for cleaning wounds, absorbing fluid, and applying topical medications. Antiseptic swab, the germ killer. A cotton-tipped applicator saturated with alcohol or povidone iodine. Nurses use this to aggressively sanitize the skin before performing injections or starting IVs. Bandage scissors, specialized cutting tools. They feature an angled blade and a unique blunt, rounded tip, allowing nurses to safely slide the scissors directly underneath tight bandages and cut them without snipping the patient's skin. Forceps, precision grabbing instruments. Used for gripping small objects, sutures, or tissue during sterile procedures, these hinged stainless steel clamps are essential for fine motor tasks. The scalpel, the surgical blade. This incredibly sharp, disposable steel blade attached to a reusable metal handle is used by surgeons and specialized nurses for making precise incisions in tissue. Sutures, medical thread. Used for closing deep wounds or incisions, these specialized sterile threads can be absorbable, melting over time, or non-absorbable, which require manual removal later. Adhesive tape, better known as medical tape. This non-allergenic, permeable fabric or plastic tape is the primary tool for securing gauze sponges, bandages, or IV tubing directly to the patient's skin. Transparent dressing, often called by the brand Tegaderm,
a thin semi-permeable film that acts like an external layer of skin. It creates a sterile barrier, locking out bacteria while allowing the nurse to visually inspect the wound without removing the dressing. Hydrogel dressing, the moisture lock. Composed mostly of water in a polymer matrix, this cool, gelatinous pad provides immediate pain relief while maintaining a moist environment that aggressively accelerates the wound healing process.